Have you noticed concerning changes in a loved one recently? Many think old age death is sudden, but the body often gives subtle warnings. These warnings can appear months or even a year before the end. People often miss these small initial signs. Families only realize the clues were there later. But then it's too late to prepare or make lasting memories. This video will discuss 5 key signs that often appear a year before an elderly person dies. Some signs may be things you've dismissed as just aging. Others might seem small, but signal the body's decline. Knowing these signs early lets you provide better care, value important moments, and ensure comfort, respect, and peace in their final stage. Watch until the end to prepare emotionally and practically. Understanding these signs will help you make the most of your time with loved ones. Let's begin. First, significant weight loss is an early sign someone may be near the end. It might seem small at first, like needing to tighten a belt or clothes feeling looser. Families often think it's just old age, but losing weight without trying is rarely good. It often means the body isn't absorbing nutrients well, muscle is decreasing, and systems are slowing down. Aging causes some muscle loss, but quick loss indicates something deeper. The body might struggle to digest food or process protein, leading to muscle loss. This weakness makes movement hard, increases fall risk, weakens the immune system, and increases infection risk. Another reason for weight loss is appetite changes. Many elderly people lose their appetite. Their taste fades, food isn't enjoyable, and they skip meals or eat less. This isn't just preference, it's a physical change. The body, sensing it's shutting down, doesn't signal hunger as often. This results in less energy, less strength, and a declining health. Underlying conditions also play a role. Weight loss is a symptom of diseases like cancer, heart failure, or kidney disease, which can progress before other symptoms appear. Even depression or cognitive decline can reduce eating, causing a decline. Some families encourage loved ones to eat more, offering favorite foods or supplements. But if weight loss continues, the issue isn't just diet. It's the body preparing for a transition. Forcing large meals might not help. Focusing on comfort, easy-to-eat foods, and hydration can improve quality of life. If you notice significant weight loss, especially with less eating, weakness, or inactivity, pay attention. It's the body sending a message. Understanding it helps you prepare with compassion and make every moment meaningful. Second, extreme fatigue and weakness can appear a year before the end. It's not just tiredness after a long day, it's exhaustion that makes simple tasks overwhelming. Getting out of bed is hard, walking is difficult, and routine activities like cooking or talking feel draining. This isn't just aging, it's the body saving energy. As organs slow down, the body prioritizes essentials. The heart doesn't pump well, circulation weakens, and muscles don't get enough oxygen. This makes elderly people feel weak, unsteady, and unable to do what they used to. Metabolic slowdown is another factor. The body uses energy, but as it prepares for the end, energy is redirected. Instead of fueling movement, the body shifts to preservation. This causes more sleeping, longer naps, and difficulty staying awake. Some experience sudden energy drops, seeming fine one moment but drained the next. The emotional impact of fatigue is heartbreaking. Seniors who valued independence feel frustrated or embarrassed they can't do things. They might withdraw from conversations, avoid socializing, or stop hobbies because they lack energy. This leads to isolation, accelerating decline. Watching a loved one go from active to exhausted is painful. It's easy to think they're lazy, but forcing activity won't help. Understanding their limits, allowing rest, and making days comfortable matters most. If a loved one experiences deep fatigue, not relieved by rest, it's a major transition. Cherish conversations, create peace, and support them without expectations. What matters most is feeling loved, understood, and at ease. Third, increased confusion or withdrawal can occur. Thinking, communicating, and interacting can change. Someone once sharp might forget things, struggle to follow conversations, or seem lost in familiar places. They might repeat themselves, forget names, or lose track of time, even without prior memory issues. These changes can happen months before death. This isn't just forgetfulness. The brain needs oxygen and nutrients. As circulation weakens and oxygen decreases, cognitive function declines. The person might become confused, struggle to make decisions, or fail to recognize people and places. They might have brief moments of clarity followed by confusion, as if their mind is fading. Emotional withdrawal is another sign. Someone nearing the end loses interest in socializing. They might speak less, engage less, or sit in silence. It's not that they don't care, their brain processes emotions differently. Conversations become tiring, loud places feel overwhelming, and they retreat into their own world. Mood and behavior can also change. Some become irritable, anxious, or frustrated. Others seem calm, detached, or indifferent. This isn't just a personality shift. It's the brain adjusting to decline. As cognitive function slows, emotions are harder to express, and they stop reacting as they used to. This stage is difficult for families. Watching a loved one lose touch with reality or pull away feels like losing them before they're gone. But it's important to remember they can't control it. Instead of forcing conversations, meet them where they are, speak gently, reassure them, and understand they can still feel your presence even if they don't always respond. If a loved one is becoming forgetful, confused, or less engaged, don't ignore it. These are early signs. The body and mind are preparing for the end. Be patient, cherish quiet moments, and create a safe, familiar, and peaceful environment. Even when words fade, love and comfort can still be felt. Fourth, frequent infections and slow healing can occur as the immune system weakens. Someone who rarely got sick might now catch every cold or infection. Minor illnesses take longer to recover from, and wounds heal slower. These changes mean the body can't defend or repair itself. Repeated infections are a concern. Pneumonia, urinary tract infections, skin infections, and oral infections become common, and families might think these are isolated illnesses, but frequent or prolonged infections indicate the body is losing its ability to fight back. Antibiotics might seem less effective. The person might need stronger medications, longer recovery, or multiple treatments for minor infections. As circulation slows and organs decline, the body doesn't respond to treatment as well. Chronic wounds are another issue. If small scratches, sores, or bruises aren't healing or keep reopening, circulation might be compromised. Poor blood flow means oxygen and nutrients aren't reaching the skin, slowing healing. Pressure sores, especially for those less mobile, become a risk and can lead to infections if not managed. Infections in the final year might not look as expected. Instead of a high fever, an elderly person might seem more tired, confused, or less interested in eating. A sudden decline in mental alertness is often the first sign of infection, even before other symptoms. Recognizing these changes early can improve comfort and support in their final stage. Watching a loved one go through repeated infections can be frustrating and heartbreaking. It's tempting to push for aggressive treatments, hoping for a fix. But at a certain point, the focus shifts from curing to comforting. Hydration, clean skin, and minimizing stress can improve well-being more than medications that prolong suffering. Fifth, major changes in breathing or circulation can occur. Breathing patterns and circulation change noticeably. Your loved one might breathe more slowly or shallowly. They might pause between breaths, or their breathing might become irregular, speeding up and slowing down. Some experience Cheney-Stokes respiration, where breathing alternates between deep, rapid breaths and long pauses. These changes can start subtly but become more pronounced. Weakened circulation is another sign. Their hands, feet, or nose and ears might feel cold. The skin might appear pale, bluish, or mottled, especially around the fingers and toes. The body is prioritizing blood flow to vital organs, reducing circulation to the extremities. This indicates the heart isn't pumping as strongly. Some experience shortness of breath, even with minimal movement. Sitting up, speaking, or shifting might cause them to feel winded. They might breathe through their mouth more often, or need to stop and catch their breath while talking. If they once walked easily but now struggle, lung function might be declining. Fluid buildup in the lungs can make breathing difficult. This can cause a cough, gurgling sounds, or chest tightness. Many think it's just congestion, but in elderly individuals nearing the end, it's often a sign the lungs are weakening. Lying flat might be uncomfortable, and they might prefer to sleep propped up on pillows or in a recliner to ease breathing. Seeing these changes can be frightening. It's natural to want to help, but this is often the body's natural way of slowing down. There might not always be a way to reverse these changes, but there are ways to make them more comfortable. Keeping the room cool, using a humidifier, or offering sips of water can help. Medications or oxygen therapy can provide relief, but the focus shifts toward comfort rather than fixing the issue. If you notice changes in breathing, cold hands and feet, or bluish skin, pay attention. These indicate the body is conserving energy and circulation is slowing down. Be present, offer reassurance, and create a peaceful environment where they feel safe and at ease. In these final months or weeks, the most important thing you can give them isn't medical intervention. It's comfort, dignity, and the knowledge that they are not alone. In conclusion, remember the 5 signs: weight loss, fatigue, cognitive decline, frequent infections, and changes in breathing and circulation. These often appear in the year before an elderly person's death. They might not all happen at once or be obvious, but noticing them indicates the body is preparing for its final transition. These changes can be difficult to accept. It's natural to want to fight them, but sometimes the best thing is to listen to the body. Instead of reversing the inevitable, focus on making their remaining time peaceful, comfortable, and meaningful. Understanding these signs isn't about fearing death, it's about being prepared. Recognizing these changes early lets you offer better care, make important decisions, and ensure their final months are filled with love and dignity. This is a time for cherishing moments, sharing stories, and letting them know they are valued and not alone. If you're noticing these signs in someone close to you, remember you are not alone. Many families have walked this path, and knowing what to expect can help you find strength, patience, and peace.